how are you doing today? I hope you're good. My name is Ori. If you're new to this channel, we talk about all things random. So welcome to Just Random with Ori. We can talk about health, we can talk about life, we can talk about family, we can talk about just anything. Name it. So welcome. I hope you subscribe and join the family today. And for those of us who have been visiting and watching regularly, I appreciate it so much. Welcome again to today's segment or to today's episode. So as usual, I have something interesting for you. And what we'll be talking about today, we'll be diving into health topic, right? We'll talk about I'd like to talk about hypertension today. This topic is quite close to my heart for several reasons. I realize that a lot of young people think that hypertension is a sickness of the old. It cannot happen to me because I'm young. It cannot happen to me because my parents don't have it. It cannot happen to me because I'm living a good life. I eat well. I work out. So I'm not feeling anything. So therefore I'm fine. Well, it doesn't work like that. So for those of us that don't really understand what I'm talking about when I say hypertension, I mean what lay people or what some people will call BP. It's actually not BP. BP is short in to elaborate what BP is. It means blood pressure. So people just say I get BP, I get BP. Every human being literally has BP, if that's what we mean. BP is blood pressure. That's just the pressure that is present in blood vessels required to send blood all over our body. That's the most simple way I can put it for us. So, and this blood pressure can either be high or low. If it's low, it's called hypotension. Hypotension, that's low blood pressure. Low blood pressure can be caused by various things, some of which would include emotional stress, dehydration, say from maybe heat stroke. You know, when you're standing in the sun for a long time, your body finds a way of trying to emit some of those heats for you, and when it does that by basically dilating the blood vessels, right? It dilates the blood vessels in your skin to allow a lot of that heat to leave your body. Yes, it's trying to help you cope with the hot weather, and by doing that, that pressure is dropping. The pressure in the blood vessels are dropping, so that can actually cause, and if you're in a place that's very hot, it can actually cause your blood pressure to go down. For those that, another way to be dehydrated is for somebody who is having a case of diarrhea, you're stooling a lot and you're not visiting the hospital, you're not doing anything about it, you're not hydrating, because some people will be stooling and vomiting at the same time, so they are losing a lot of fluids and electrolytes and they're not replacing any of those things. They will get dehydrated, and this will cause hypotension, which will eventually lead to shock, hypovolemic shock, and that's how some people die. That's how you hear that some people were stooling so much and then they passed away. Yes, it's hypotension. So whichever type, be it hypo or hyper, that's either low blood pressure or high blood pressure, it's important, which is part of the reason why we're talking about it today. So those are some of the causes of hypotension. The other variant of blood pressure related issues would be hypertension, which is what most people know about, and which is what most people even refer to as BP, blood pressure. So blood pressure, high blood pressure simply means that the normal value for the blood pressure has been exceeded. The normal value with which the body actually controls the pressure on its own has been exceeded. The body is no longer able to control that pressure on its own. It's no longer able. The baroreceptors present in our bodies that help us to do that control is not able to do it for us anymore. So this person now comes down with hypertension. That is what you know as hypertension. So what are the things that can cause hypertension? I can only discuss these things by also telling you about the types of hypertension that there is. We have two major classes of hypertension. We have the primary hypertension and we have the secondary hypertension. So in medicine, a lot of times we like to use those terminologies to devise things, right, based on etiology or based on their causative factors. So when we say primary, we mean that the problem is coming from that particular organ, right? And when we say secondary, it means that it's coming from some other factors, right? So the problem is coming from Secondary hypertension is really coming from another source, from some other organ. For example, if there are issues, if the person has some endocrine problems, see, I have to keep breaking down a lot of terminologies, which is part of why I don't really like doing some of these videos, but we need to be aware of these things. A lot of young folks out there to be aware of hypertension. It's not for the old at all. It's for everybody. Anybody could have it. So yeah, secondary hypertension comes from other sources, one of which could be endocrine. So when I say endocrine, or whenever I mention endocrine, I'm actually referring to hormonal related things. So if someone is having issues with their thyroid gland, right? Say the thyroid function, either low, if it's the hypothyroidism, like if the thyroid is not functioning as it should, it could cause hypotension, that's a low one. And if it's functioning more than it should, it could cause hypertension. So things like that can actually cause hypertension. Other things can be a condition we call pheochromocytoma. That's also when there's like increased secretion of certain hormones too. They will also cause hypertension. So endocrine sources are one thing. People with renal diseases, that's kidney diseases, chronic kidney diseases, can also come down with hypertension. So many things can cause hypertension. And to go further with the causes, there are other factors that can predispose a person to coming down with hypertension or to experiencing hypertension. Some of these will be the lifestyle of that person. If the person has a sedentary lifestyle, they are prone to it. If there's a person that abuses salt, you like to have a lot of salt in your meals, can predispose you to that. If you're a young person or whoever you are, you take a lot of alcohol consumption is so much, you're prone to it. If you smoke a lot, you're prone to it. There are so many factors that could predispose a person. Genetics too. Say in the family line, you get to see that your parents, maybe they had it when they were growing up, they were still young when they had it, or it's just in a lineage. Your grandparents had it, your parents have it, one of your siblings have it. You're prone to it. And yeah, I think that's basically it. So genetic, your lifestyle, your habits, all those things can predispose a person to hypertension. Having gone through these courses, what are some of the things that one can experience when they have hypertension? Typically, we can't say like in every other disease that hypertension has signs and symptoms, or that they have symptoms that we look out for. That when you start, okay, for example, malaria, you know that when your body is hot, you're having fever, or you're having some other symptoms, you can say, oh yes, this is malaria. That doesn't really work for hypertension, because a lot of times, typically, hypertension is asymptomatic. So you would not really know, except you do check your blood pressure regularly. So you would typically not know. But there are some other signs, that there are some symptoms that can actually happen. Maybe if it has stayed for some time, it's now becoming sort of long term, you start noticing something, especially when your body is not used to such high values in a long period of time. It will start showing you in some ways. Some of the things that you would experience, or that I've come across in the outpatient departments, that newly, for people that have not yet been diagnosed, that will come and they will tell you, oh, I'm having headaches. This headache just doesn't go away. Where do you feel the headache? You ask them, where do you feel the headache? And they will tell you, the back of my head. It's different. It's always here. I feel the headache here. And then sometimes it's not even headache. Sometimes they will complain of fullness of the head. My head it just feels full. It feels like there's a band. There's something grabbing my head like this. It just feels heavy. It just doesn't feel right. You can start thinking of hypertension, or start experiencing things like blurry vision. Maybe you're not seeing clearly, or you start experiencing like dizziness, vertigo. Those two terms can be confused with each other. So let me break it down into two. So when you start experiencing things, when you start feeling like the room is spinning, like your environment is spinning, you can suspect that your blood pressure is probably not controlled. Or you're having eye turning, your eyes are turning you. You can suspect that hypertension might be coming in. Another thing that some people will complain about is poor sleep. They are not able to sleep fine. They can't sleep well, or they can't sustain sleep. Insomnia starts to come in, and some people they just feel unwell. They just don't feel well as they used to. They're not just feeling as they would normally feel. Yeah, so those things will just, when you start having things like that, go to the nearest facility that can check your blood pressure for you. Just go and check your blood pressure. Be sure of how you are. I mean, to check your blood pressure really doesn't take a lot. It doesn't, and you don't necessarily have to spend money. If you have, can go to a close by pharmacy or even to the hospital. Just explain to them that you don't have money, you just want to check your blood pressure, please, and they would indulge you. They would indulge you as long as they're not spending money to check your blood pressure. They would actually check your blood pressure. So anywhere you are, if you just feel or you experience some of these things I just mentioned, go to the nearest place and check your blood pressure just to be safe, just to be sure that you're not having any issues there. Okay. What else would I want to talk about? Why do we care about hypertension so much, or why should we be worried about it, or why should we be concerned about it? Well, it's because of the threats, the complications that it poses, the things that hypertension can do. So over time, hypertension is a chronic ailment. Chronic in the sense that it's not something that just comes and then you treat it and it goes, right? It's something that is ongoing, it's progressive. So what we can do is to make sure we keep it controlled, because at every point where it is not controlled, it's causing some damage to vital organs. And there are 5 major organs that hypertension usually affects. It affects blood vessels, it can affect the brain, can affect the eyes, can affect the heart, and can affect the kidneys. So these are 5 major organs that hypertension affects, and these are vital organs. These are very vital organs. It can cause heart failure, can cause kidney failure, it can cause aneurysms, that is rupture of blood vessels, and it can cause stroke. It can cause can interfere with the vision, right? So these are some of the issues, and these are part of the reasons why we pay attention to hypertension. Maybe some other day I will give you we'll talk about the complications in more detail, but for today I'm just touching on some of I'm just telling you, giving you general knowledge about hypertension. See how important it is to be well informed or to have knowledge, because checking your blood pressure, right, is one thing, but then knowing the correct value to stand by, knowing when it's actually in normal range and when it's actually so high, is another thing. It's good to know the value. As I'm going to put up, I'm going to show you the classification. I'll try and put up a picture, a display picture, to give you the classification of the value, like, so you know what is normal and what is not. So that wherever you go and you check your blood pressure, you know what exactly is normal. I was discussing with somebody earlier today about hypertension and the issues with both age groups, like the elderly and the young people. And I found out that another problem that we have for young people, apart from the lifestyle, with alcohol and smoking and all that, those that are now diagnosed with hypertension, because of the pressures of life, a lot of elderly people kind of have this issue taken care of by their children. So their children send them money for medications, or they are under insurance schemes that gives them access to the medication monthly. Compared to a young man or a young woman who is hypertensive, especially young men, most young male patients that I have, it's such an issue for them, because they're trying to make money to support themselves, support their families, and when their drugs get exhausted, instead of prioritizing those drugs, especially when they're not so buoyant financially, they will rather spend that money on what they would consider as more pressing issues or more important. And this would invariably cause them to not adhere to their medications, and over time it poses a lot of risk. Now their BP is no longer controlled over a period of time. Unfortunately for some people, this uncontrolled blood pressure, which is hypertension, can now, one of the complications of the hypertensive crisis, can now arise. One of the common ones all of us know is stroke. Now, stroke can occur, and we have different types of stroke. I will try my best not to divulge so much on the complications. Like I said, I'm going to do a different video on the complications of hypertension. But this is I just wanted to point this out, because I want to hit the nail on the head in this video by letting young people understand that hypertension is important for you. In hypertension, it's quite important. Your care, your daily care or your monthly care is very important. It's as important, you're taking your medication or adhering to your medication is as important as your lifestyle modification, just as your lifestyle modification is very important as well in the care of someone with hypertension. It's very important. So don't just say that, oh, I've cut down on salt, or I've cut down on alcohol, I've cut down on. What about your medication? What about checking your blood pressure? Are you checking it? Check it like twice a week. That's fine. And then when you check it and you see that it's high, oh, I don't have money to get drugs now, I will get it later. Please do not do that. I beg of you, don't do that. Okay? There are so many things that people, actually in our environment, will come up with herbs or teas, and of course I'm aware that some of these things actually help, but in long run, would they actually always help? Do you check your blood pressure? Do you monitor your blood pressure regularly to know that they are helping you? Those are the issues, and this has led, unfortunately, it has led to the demise of so many of our young folks, of so many of our friends. It's quite sad to know that the death of some people could have been averted or could have been prevented if only they knew to prioritize their medications, or to prioritize the care of themselves, or care of their health. So this is why I decided to talk about hypertension today. It's important for you to adhere to your medications. Drug adherence is a big deal in hypertension. You should not be afraid. Hypertension is not scary, like some people try to make it look like. It's not scary. It's only scary when you don't take care of yourself. That's the only time it's scary. You understand? Because you really never know. But you are aware, you check yourself, your blood pressure, the value, the right value, what it's supposed to be when it's normal, what it's supposed to be when it's high. And then you also are aware that there are levels to there's a severity chain when it comes to hypertension. There's mild, there's moderate, there's severe. So when somebody just say, your BP is high, your mind, you're already very scared because you're thinking, hey, what's going to happen? They say my BP is high. That thing that they said, my BP is high, your BP is high, it might just mean it's mildly high. It's a little bit, elevated. But if you know the value, you would know, what to expect, what to do to care for yourself, right? And then you're able to adhere to your medications as well. So I hope I've been able to enlighten you a little bit on hypertension. Red flags that you should take note of. Any of your relatives with hypertension, by the time you start noticing that they are not as active as they used to be, they are complaining continuously of headaches, they are not sleeping fine, there's something odd about their speech, about the movement of their limbs, either both, all movements. Just once you just notice some things that are not, that are not the usual, or they start saying something about their vision, they can't see properly, or whenever you notice a change in their normal, activity, the way they usually do, then encourage them to visit the hospital, encourage them to check their blood pressure, encourage them to take their medications. It's not easy. If you're a chronically ill patient, it's not actually easy to adhere to your medications, because these are medications that you have to take every day of your life. So it's not easy. So if you're a relative of anybody that is hypertensive, or you are hypertensive, please give help, render encouragement to these people. And also, if you are the patient, it's okay to seek help. It's okay to talk to somebody. It's okay to seek encouragement from someone you love, from someone close by, from someone that knows about your health condition. And your doctors are there, right? Your doctors are there. Sometimes your visits to the hospital, your routine checkups, what we say recommend routine checkups, is not just to check your BP and give you drugs. Sometimes it's to talk to you, it's to counsel you, to check how you're doing so far with the medications. Even if you're not been taking your drug, come, so that the doctor can talk to you about the hypertension, can remind you about the reasons why you're taking them, can lift up your spirits about, from where you're coming, from where, because they will have your records. They'll be able to encourage you by letting you know, the results you've had over time with these medications. So yes, I hope I've been able to enlighten you. I hope I've been able to draw to your attention the things that really matter about hypertension. I hope I'll be able to really, really educate you a little bit on it. Thank you for tuning in. Thank you for your time. As always, I really appreciate you all. Please do well to share this video to as much as you can. Let people know, make them aware. Hypertension is not just sickness for the old, it's also sickness for the young, especially with, a rise in bad habits, bad health habits. Okay, do well to reduce salt from your food, do well to reduce alcohol consumption, do well to cut down very well on smoking. Alert people about their health in the long run. Thank you so much for tuning in, and I hope to see you in my next episode. Look out for it. I would like to keep making videos for you. Engage me in the comment section, like, subscribe. Till next time, dear Londoners, I appreciate you. Have a wonderful time.